Alright everyone, welcome to the latest video in the Health Files playlist here at Duncan's Family Channel. And in this video, I'm going to be talking to you about my recent experience getting some dental work done at Tooth & Co, which is a dental clinic in Kuantan. Now, I used to go to the local government dental clinic in Kuantan and went there for many years. It's very cheap. We paid between 1 and 2 ringgit to see a dentist and have some work done, whether that was a filling, whether that was just a check, or whether it included some scaling. Whatever it was just 1 or 2 ringgit. But that included really long wait times. Sometimes we would wait over an hour to get into a room to see a dentist. And the work they did on the teeth was okay, but it was nowhere near as good, as caring, or as professional as what I just encountered at Tooth & Co. So we actually know the owner of Tooth & Co. We are friends with the owner, so that's how we knew about this dental clinic. And so we decided, well, let's give it a try. It's also located right near my daughter's primary school, so it became a really good location for me to go and get my teeth checked, and then to be able to very quickly and conveniently pick up my daughter from school right afterwards. So before I went for my first appointment, I read a load of reviews on Google about Tooth & Co. I noticed that every single review was good, it was positive. People were having great experiences with a number of different dentists that work there. And so I set my first appointment for Tuesday the 2nd of January of 2024. And we went there and I saw Dr. Balkis. Dr. Balkis is a lady dentist who works at Tooth & Co. And during the course of my 3 appointments with her, I have had a really good and positive experience with Dr. Balkis caring for my teeth. The reason I first went there is because one of my old fillings in a tooth in my lower jaw had come out one night while I was brushing, and so I needed to go back to get it refilled. And so that is the first job that Dr. Balkis did for me on Tuesday the 2nd of January. It took about half an hour in total. She began by looking at my teeth and doing a check of everything. That's when she also noticed that I needed another filling on a different tooth at the upper row because there was a small cavity there. But she began with the one where my filling had come out. And she took a look at it, and then she sat me back up in the chair and she talked and she explained what was wrong with my tooth, what she was going to do. She explained it step by step. Throughout the procedure, she kind of stopped and started. She gave me a mirror, which I held in my hand so that I could see my tooth. And she showed me how she had cleaned it and what it looks like and what she was going to do next. So it was really... It felt really good to hear these explanations and to really feel involved and feel a part of it. And it was quite comforting, shall we say, in a way. So that was really nice. The procedure was pretty good, just minimal pain while she was doing the cleaning. And then she filled it nicely and also polished it at the end as well. And then talked to me again afterwards and gave some advice and tips. And so it was just a really, really good positive experience. So the price for that filling came to 180 ringgit. Now, that is 180 times more than what I would have paid if I went to the government dentist where I had been going for many, many years. But considering that I received a really professional job, that the dentist was very gentle, she knew what she was doing, she explained step by step I was given a mirror to see what was happening and what was going on. I had no wait time at the clinic because they only schedule one person for every hour, so that there is no waiting time. You can come in and basically within 1 or 2 minutes you are straight into the surgery to get your treatment done. So considering all of that, the first visit of 180 ringgit I thought was a very reasonable price, because I feel like it was such a good quality of service and I felt happy to pay that. A week later, on the 9th of January, I returned for my second appointment, and for this one I was getting a filling done on the upper row, which the dentist had made me aware of from the first visit. And so one of these teeth on the upper row actually had 3 very small cavities. So again, she cleaned it out. These first 2 appointments I had no anesthetic, no general anesthetic or anything like that. She cleaned it out. There was a little bit of pain, of course, but it wasn't enough to really make me go, So I lay there in the chair and very bravely just kept calm and just took the little bit of pain during the cleaning. So she cleaned out the 3 cavities and then she filled each one of them. Did a very nice job again. She also then proceeded to do some scaling. So she cleaned in between all of my teeth, upper and lower rows, and then gave them a bit of a polishing as well. And so that was another very nice experience. It took probably around half an hour again in total, but the time really flew by very quickly. And this treatment came to a total of 220 ringgit, which again, for the filling, including scaling and polishing, I thought was a very reasonable price. I was fearing it might be a lot more, but it wasn't. So I was quite pleased and satisfied. And by this point, after having 2 appointments with Dr. Balkis, I had begun to develop a total trust and confidence in this dentist, so that thinking about my third appointment, it wasn't really feeling very scary anymore, because I had total trust that Dr. Balkis knows what she's doing and she is going to do a good job. So on my third visit, on the 16th of January, I was having an old filling that had gone dirty and old and needed to be replaced. I was having that replaced. And this was a tooth on the bottom row of my jaw, kind of close to the middle teeth. It was a few teeth away from the middle. And for this one, I had to have an anesthetic jab. So Dr. Balkis just rubbed some gel around my gum, around that tooth at the front and the back. And then she got the gigantic needle, the jab, so that she could inject the anesthetic into my gum. Now, when she was starting to do this, she was saying, sorry, sir, this might hurt a little. But as she was putting it in, my mouth had already numbed up from the gel. I could feel that I was being injected, but there was no pain at all. And so I just lay there and she injected 2 times. And then I sat up and she asked me to wash out my mouth with some water, spit it out, wiped it with a tissue. My mouth was really numbing up by this point, like almost immediately. I could barely feel it when I was trying to wipe my mouth, wipe the water off it. So it had already gone really numb. And just maybe a minute or 2 later, after she explained again what she was going to do, I lay down and we started the procedure. On this occasion, it was a little bit more tricky because she wanted to isolate the tooth that she was working on so that saliva or other stuff would not disturb it. So I had to have the blue plastic kind of cover over my tooth. They made a hole in it to go around my tooth and then kind of clamped the tooth to hold it stable. And it felt really, really tight just for a few seconds when they were putting that on. It felt like my tooth was going to come out, and I was just like, oh. But then once it was on, then that tightness kind of went away, and she started doing the work. And because of the anesthetic, I felt no pain at all. So it was really nice just to lie there. Now, I had my mouth open with the blue plastic covering and the tooth clamped, which was not the most comfortable of positions for my mouth. And about halfway through the procedure, she put a small little green colour kind of wedge on the other side of my mouth, in between my upper and lower rows of teeth, just for the teeth to kind of rest on, to help keep my mouth open. So all in all, it was not comfortable, but I just lay there super bravely, and I just kept myself calm, and I just controlled my breathing through my nose, and everything went well. She cleaned out she took away the old filling, cleaned out the tooth. She found that the nerves were still good, the root was okay. She cleared out any bacteria that was in there, and it was not as bad as what she feared it might be. So that was really great news. So it just became a normal filling again. She placed some alkaline medicine inside the tooth just to try to stop the tooth going bad from the inside, because bacteria breeds in the acidic environment. So she put some alkaline stuff inside the tooth, which I thought was really good. And then she proceeded to refill it again. And then this one took about 45 minutes in total, 45 to 50 minutes for this procedure. She also took an x-ray of my tooth before she actually started the procedure. She got this little small rectangular little wedge, and she put it inside my mouth along beside my tooth, between my cheek and my tooth, and that was to take an x-ray of my teeth. And then she was able to see the teeth, and she talked a lot to me and explained everything about my tooth and what was going on, etc., etc. So yeah, overall it was really good. Then she had to take off the clamp from my tooth and take the blue plastic covering off as well, and it felt a little bit tight again, but then it was off and it was okay. She polished it, and then she gave me a consultation again at the end of the procedure when I was sitting back up in the chair, and she explained a lot of things about the tooth, the vitality of the tooth and how it's doing and what might need to happen in the future. And she mentioned that I might need a root canal treatment in the future, maybe in another year or so. But that would also depend on how I look after my teeth and brush properly, and if everything is fine within, inside the tooth as well. So I got that consultation afterwards. Everything was great. That treatment came to 200 ringgit, which meant my 3 treatments, which included 3 fillings plus a scaling and polishing, came to a total of 600 ringgit. And I think for the quality of service that I received and the professionalism of Dr. Balkis and how comfortable she made me feel as the patient, and 0 to minimum wait times, that whole experience was wonderful, and I'm very happy to pay 600 ringgit for that kind of experience at a dental clinic. So that's the report of my experience at Tooth & Co. Dental Clinic in Kuantan, Malaysia. I highly recommend it. The dentists there are excellent. The service is excellent. The wait times is very minimal, and it's highly recommended. No matter what you need to do, whether it's just a checkup, whether it's cleaning, scaling, whether you need a filling, root canal treatment, whatever it's going to be, I really suggest that you go and see the dentist at Tooth & Co. Because let's face it, the dental clinics are not the most comfortable of places. We don't really enjoy going to see a dentist, right? It's very scary for many people, including myself. But I've gone a long way towards overcoming that fear through these appointments that I've had. And so, yeah, go over to Tooth & Co. Give it a try, and see the good experience that's waiting for you there. And of course, it's really important to look after your teeth. If I had looked after my teeth better many years ago, I wouldn't have got to this position where I need a few fillings and maybe more treatment in the future. So as soon as you find something wrong with your teeth, just overcome whatever fear you might have and just get to that dentist and sort it out while it's still a small problem. Yeah, because you only get your teeth once, and then once they're gone, they're gone. So yeah, and healthy teeth equals healthy body and healthy life as well. So there you are. Hope you enjoyed listening to this video, and I will see you again for more Health Files videos in the future. Thank you very much for watching Duncan's Family Channel. Please consider liking this video if you enjoyed the content, if you found it useful or educational, and go ahead and subscribe to the channel. Thank you very much. Bye-bye.